Dr. Lou.
Hello.
How are you? What's going on?
Nice to see you.
Good to see you again. Hi there. I'm Dr. Drew. Nice to see you.
I'm Keisha.
You're Keisha. All right. Why are you here, Keisha?
Well, I'm here because every time I shave or wax anything, I get like unsightly razor burn and grown hairs. Yeah, it gets pretty bad.
I can see that.
I've tried laser hair removal before, and they always tell me it's going to be unsuccessful because of my dark skin, and I just don't think that's fair.
You came to the right doctor right here. So, Dr. Lou, tell us a little bit more about razor burn. Such a common problem that affects a lot of women.
It does. So there's two main factors that can cause razor burn or these kind of what I call bikini bumps. The one is genetics. So if you have slightly thicker hair or even a little bit of curl to the hair itself can ingrown, and that's a problem by itself. The second component is when you try to groom, if you cause trauma, it can get irritated, inflamed, infected, and all sorts of things can happen. You can get little small bumps that can actually chelate and scar. You can get pigmentation around the hair follicle. And so you can have successful hair removal. You have to just have the right device and the right preparation with the procedure. So I'm going to get the machine set up here, and while I'm doing that, Nellie's going to cool the skin. So this is the Palomar Icon hair removal machine. I'm going to have everyone put their goggles on, and while we're setting this up, Nellie was icing and cooling her skin. So we're going to do some pulses here. What happens is the energy for hair removal has to go deep through the skin, and if you don't cool the skin, you can burn the skin.
How's that feel?
It feels okay.
Little
Feels
snap.
Yeah.
So we're going to pause for a second, go ahead and ice again. So icing is really important here because if you cool the skin and protect the epidermis, she's not going to get a burn on the surface of her skin, which she did experience before. I think you shared that with me earlier. And go ahead and move it. We're going to do a couple more pulses here. So what happens is if you have the right setting, it will fire down to the root of the hair follicle, eject the hair follicle, successfully remove the hair, and then you're done.
Because we know different phases of hair, I assume that she's going to need more than one treatment.
That's correct. She'll probably need between 8 to 12 sessions because you do need to do it stepwise and get at the right cycle. But we can certainly get you results to get you feeling better. This is something that not everyone can do. And if you can't, we do have some recommendations. One is, for example, shaving. You want to make sure that you use a new blade frequently because if you have a dull blade, it can traumatize the skin.
Don't share blades, right?
Yeah. You also want to make sure that your blade is dried after you use it if you're going to reuse it because you don't want it to rust or collect bacteria. And then also a good hydrating gel that's hypoallergenic to give some nice lubrication is important too. The Aftercare, there are some recommendations at home too. You want to reduce inflammation and irritation, so you can do things like aloe vera or tea tree oil that do have those properties without going into the office.
Great tips.
Yeah.
Especially this time of year.
Yeah.
Gotta get ready for bikini.
This was, not an easy problem to share, and we really appreciate you trying to help others, in the audience, and so we're going to do some treatment for you if you want to come back to my practice.
Yeah. Yes.
You're in good hands.
Very good.
Thank
Good
you.
stuff. Thank you so very much, Dr. Lou. Good luck to you, Keisha.